Today, we're going to explore the reasons behind the development of dark spots on your genital lips. While frequent blade shaving, aging, and hormonal changes can contribute to the darkening, it's important to consider other factors like vulvar melanosis or psoriasis as potential causes. Stay with us as we explore the 8 possible reasons behind the appearance of these spots on your body. Number 1. Frequent shaving. Regularly using a blade to shave can lead to the development of darkened patches on the skin. This occurs because the skin's deeper layers, known as the dermis, experience stress from the shaving process, causing an increase in the production of melanin, the pigment responsible for skin color. Not only can shaving alter skin's tone, but can also result in wounds, cuts, and irritation. How to treat it? Generally, these dark spots tend to fade over time. To speed up their fading, it's important to either stop shaving or transition to an alternative hair removal technique. A dermatologist may suggest using creams or gels with gradual lightening effects containing ingredients such as vitamin B, C, and phytic acid. These components can help restore the skin's natural tone over time. Number 2. Aging. As time passes, changes occur in the female genital area, including shifts in the skin's natural pigmentation. Starting around age 50, hyperpigmentation issues may arise, resulting in darkening of various skin areas, including the genital lips. As we age, the number of melanocytes decreases in the outermost skin layer, the epidermis. However, the existing melanocytes become larger and are concentrated in specific areas, leading to the formation of prominent dark spots. How to treat it? Dermatologists commonly recommend specialized intimate creams for lightening these spots and rejuvenating the area in general. Alternatively, CO2 laser whitening treatments could also be advised. This technique swiftly reduces pigmentation in the genital area. Number 3. Hormonal changes. Hormonal shifts occur during phases of a woman's life, like puberty, pregnancy, contraceptive usage, or menopause. These can all notably impact melanin levels and skin tone. These changes often manifest on the forehead, cheeks, nose, and genital lips, as these areas are influenced by female hormones like estrogen and progesterone. When confronted with this situation, the body triggers increased melanin production, leading to the development of dark spots on the skin. How to treat it? Treatment for these spots should strictly follow the dermatologist's guidance, given the high sensitivity of the genital lips area. Using creams with specialized formulas featuring hydroquinone as a key component is advised. This helps regulate pigmentation and reduces the chances of recurrence. Dermatologists may recommend various whitening techniques, including laser therapy, depigmenting mesotherapy, peeling, and intense pulsed light treatments. If this video has been helpful in addressing your questions, please consider showing your support for the channel by giving us a super thanks. Number 4. Lentigo. Lentigo are small, well-defined, dark brown to black spots. They are benign and don't cause any discomfort. These spots form due to an increase in melanocytes and melanin production. Lentigo commonly appears in individuals with brown skin, and it can manifest in childhood or develop gradually over time. How to treat it? Treatment for these spots typically revolves around aesthetics, primarily involving the application of specialized creams directly onto the spots multiple times a day Another approach is cryosurgery, which employs liquid nitrogen to freeze and subsequently remove the lesion. Alternatively, laser beams can also be utilized for their elimination. Number 5. Black nevus. A black nevus is a spot with a round or oval shape created by an excess of melanocytes. These benign growths can vary in size, featuring well-defined edges. They can emerge during childhood, puberty, or even pregnancy. In some cases, these nevi can change, showing uneven shapes and irregular edges, and growing to about 6 mm in diameter. Thus, it's crucial to constantly undergo dermatological assessments for these types of growth to eliminate the risk of melanoma. How to treat it? Since these spots don't cause any discomfort, they generally don't need treatment. However, if there is a concern about the possibility of melanoma, surgical treatment becomes an option. Number 6. Vulvar melanosis. Vulvar melanosis, a rare pigment change, can emerge in women during the reproductive years, often linked to pregnancy, oral contraceptive use, or human papillomavirus infection. It's marked by dark spots on the vulva, especially on the lower lips, due to melanin buildup. These spots might sometimes be mistaken for other pigmented spots, some of which could be precancerous. Appearing as dark brown or black, flat-shaped patches or marks, these spots can vary in size between 1 to 5 centimeters in diameter. Regular gynecological checkups are crucial to monitor these lesions, as they might, in certain cases, turn malignant. How to treat it? Treating these spots is possible with specialized topical medications containing depigmentation agents. These should be applied over a prolonged period as per medical advice. Another option is CO2 laser treatment to reduce excess melanin production. This procedure takes around 15 minutes and is a straightforward solution. Number 7. Psoriasis. Psoriasis affecting the genital lips is an autoimmune disorder that alters the skin color and texture in that region. It's characterized by the emergence of dark red, dry-looking patches. Typically, these spots lead to a significant itching and discomfort. They tend to be more common in overweight women and can worsen due to perspiration and wearing excessively tight undergarments. How to treat it? Managing this form of psoriasis centers around using corticosteroid ointments on the affected region and practicing appropriate local care under your treating physician's guidance. In some cases, ultraviolet light therapies might also be suggested to address this condition effectively. Number 8. Melanoma. Melanoma is a cancerous growth that originates from existing pigmented spots on normal skin. This condition appears as noticeable lump, often asymmetrical with uneven edges, and usually exceeds 0.5 centimeters in diameter. It's commonly found in the labia minora and can lead to symptoms such as bleeding, itching, and pain. How to treat it? Upon diagnosing melanoma, the typical course of action involves surgical treatment accompanied by a biopsy. Subsequent treatments will be recommended based on the biopsy results, aiming to effectively address the disease and its progression. If you found this information helpful, don't forget to give us a thumbs up and feel free to share any questions or suggestions in the comment section below. Until next time.